Can a council and its local CCG, when considering care planning for Section 117 aftercare clients, lawfully decide to minimise the number of people on record as getting a Section 117 care plan by just giving them Care Act care plans?
That would be a good wheeze, wouldn't it? Not. I have to say, it's not legal, but we're seeing a lot of it at the moment. And that's really why we're glad that the question has been asked, because it shows that we're not the only ones thinking about that. What tends to be happening is that people are discharged from hospital and everybody knows that they've got Section 117 status, but their needs, such as they are put through the Care Act criteria and found to be eligible, and they're being given Care Act care plans rather than Mental Health Act Section 117 care plans. And the only seeming difference is that the Care Act care plans are chargeable. And therefore the state is not losing money, which is, you know, a managerial wheeze, I think, for doing something unless or until it is said to be unlawful. But, you know, 20 years ago, there was a big case that went all the way up to the House of Lords, which said it is unlawful to charge people for services that they need by way of Mental Health Act aftercare. The trouble is that a lot of the domains in the Care Act could be stretched to cover people who are mentally unwell. You know, issues with relationships, issues with engaging with leisure and recreation in the local area, looking after yourself. If you've been in a psychiatric hospital for some time, you could be struggling with that whole kind of motivation thing. So on paper, it looks like the person's got a good care plan until you realise that everything that they've got ought to be free rather than chargeable. And the issue really is the strict legal issue. In this country, we've got a kind of hierarchy of overlapping powers and duties in different bits of legislation from different agencies. And there's a public law principle that says that that hierarchy running from top to bottom sort of goes like this. The more specific the duty owed under the statute is, the higher up the list it goes. The more waffly it is and the more discretion-based it is, the lower down it goes. The more beneficial the duty is for the member of the public, the higher up the ladder the duty is in terms of coming first. And then the less beneficial it is, or the more chargeable it is, the lower it goes. So when you bear in mind that Section 117 is an individually enforceable duty and it provides for free services, and there are no criteria other than what the statute says, then you can see why we're thinking that Section 117 is the highest duty in the hierarchy. And therefore, it's all a very good managerial wheeze for saving money, but to slip the Care Act in as the thing that the person first should turn to instead of the mental health aftercare provisions is dodgy in our book.